This is a podcast from the Queen City Podcast Network.
Hope. Sometimes we need help finding it. And sometimes that help comes in the form of stories of people who've lost it and found it yet again. That's why we're here. Welcome to Hope with Ramona Holloway. Hello, and welcome to Hope with Ramona Holloway. This is number 4 in a 4-part series on dementia caregivers. And I keep telling you, number 1 lesson I learned in the dementia care journey was you can't do it alone. And this wasn't something that I even wanted to do alone because resources are important. And knowing about them, that's like gold. Right here in the Charlotte community, we have Memory and Movement Charlotte. They partnered with me and loaned me their big gun for the day. His name is Dr. Chuck Edwards. He's an author. He's a podcaster. He is the founder of Memory and Movement Charlotte. And he has dedicated his practice, that nonprofit practice at Memory and Movement Charlotte, still dedicated to helping people navigate the dementia care journey, the patients and their caregivers. Because we said it before, if the caregiver goes down, the whole ship is going with it.
For sure.
Chuck, thank you so much for doing this with me.
Yeah.
I thought, because I still volunteer with the Alzheimer's Association, make sure you donate to my walk team. I'm still very active with Dementia Care Ministries. I thought I knew a lot, but I've learned from you even more. And I know that Memory and Movement Charlotte has a lot to offer this community, the caregivers and the patients. Can you tell us a little bit about how we can connect people?
Well, time and attention came. It's a term that I use because in dementia care, it's all about for the families and for the patient early on to feel like they have a place where they can be seen and where they can be listened to, even the patient. And so time means that we only see 6 or 7 patients, each physician and each team member, PAs, nurse practitioners, the whole thing. We have about 7 teams, I think, or so, 7 or 8 teams. Right now, we get 50 new patients a month, and we are recruiting physicians from anywhere in the country that we want them to come and learn what we're doing so that we can address all the needs here in Charlotte. The attention comes from recruiting the resources that are specific to the diseases we take care of. So Parkinson's, I'm really proud of what we've done with Parkinson's. We were the first people to do the skin biopsy. We were the first people to put in one of the new pumps, which has revolutionized the mobility of patients with Parkinson's. So I'm especially proud of the team that we've put together, the quality of physicians. We are really good on the science.
I'm proud of the fact that you go to some of the senior facilities and have satellite locations.
We do.
So people don't have to try to come to you. I'm proud of that.
We do that. And right now we're actually thinking about several of those satellite situations. But it has been, having done, cardiovascular surgery for 30 some odd years, even more than that, I'm afraid. I didn't know what this part of my career would have in store for me, but it has been by far the most rewarding part of it. And what's unusual about that
Why is that? Why is it so rewarding for you?
I can't fix anything. When you do surgery, your business is to fix things. And I love doing surgery. But now, strangely enough, I can't fix anything. Now, I can help caregivers. I can put patients on medications to help them with their behavior and some of the problems they have with psychosis. But actually what I do is I just kind of walk with families and patients, and I walk all the way to the end. And they don't expect me to cure anything, but actually—
There's that hope in the beginning,
yeah,
but then you realize.
And oftentimes when I'm there at the end with the family, there's a closure about it. There's I know sometimes when people are at the end and I'm there, and it's like, this must be really important. Dr. Edwards is here with us. And I think about all of the doctors that practiced for 100 years where they couldn't do anything, but they never had a higher respect. And now, of course, someone can save your life in the emergency room, and they said, oh, we had to wait 20 minutes to get it, So it has been very rewarding. And the affirmation, a physician, that this doctor-patient relationship is very, it's almost like magic, that someone comes to you with a problem and they want to tell you, and you listen to them. And then the deal is that once I've listened and I understand, I'm going to try to find a solution. My first thought or first diagnosis might not be right, but they know that, one, that you care about them, and two, you're going to keep after it until you find out exactly what's going to be wrong with them.
Okay, can we get real? Because thanks to you, I no longer want to go through any tests to see if I have dementia at this point in my life. Even though I had to take a picture of my license to make sure when I got over to the kiosk to pay for my spot that I knew my license plate. The fact that I remembered to take a picture because I've had 85 license plates because I moved all over the place. Every day something happens that I forget something, or that I wonder, do I need to be seeing you? Do I need to be calling you Dr. Edwards?
No, your brain is doing good. You're recruiting very good things out of your brain. I'm working on a book right now called Coming Closer, and it addresses, it's called Strategies for Early Memory Loss. And there are 3 parts of early memory loss. And probably the largest one is what's called age-related cognitive decline.
I'm 60.
Just the things. I've got feelings 60 years old.
But
Don't
I feel
even
like
give
my
me that.
60-year-old brain is not doing what the 30-year-old brain could do.
You're gonna, I call them big oops. Like, you're coming in and you forget, when you're buying gas and you forget your zip code. You go, wait a minute, no one's supposed to ask me my zip code. And so you kind of panic, and then you get in and say, uh-oh, here we go.
Yep.
No.
When I'm doing my baseball signals, phone, keys, glasses,
Guac. It's guac. Glasses, wallet, ass. Okay. Keys.
Wait, what's the A for?
Ass. You just want to make sure you got it all together.
That's
guac.
That's
That's mine.
Okay.
Yeah.
That's specifically for you.
And my wife does this thing. She goes, and she gives me a signal. Glasses. Wow. So, we got this thing. So,
I don't want to know what she's giving you the signal for ass for. I don't want to know, Chuck.
To all of my friends out there that have a family history, we've been put into a kind of a situation where anytime that we have a big goof, we panic a little bit, and we think that it's in our future, and it's not necessarily true. Also, we're making some, not quite enough, but we're making some inroads into medications that might help. And so I have a lot of promise for the future. We're not quite there yet, but we are getting closer. And so I don't want you to have any dismay or foreboding about this. I think we're all going to be all right.
I will say that early on in Mom's, I'll say, just health journey with, my mom was wheezy for a reason, chronic asthma, hypertension, diabetes. She lived a very sedentary lifestyle. I got a little bit ticked off at her for not managing risk factors that were making my life harder. And I recognized how selfish that was. She was getting sick, but damn it, I was sick of the way she was allowing herself to get sicker.
Right.
Like, I remember we had an argument because she loved the dog. And she told me, I'm sorry, if anything happens, we're on a ship, goes down, I'm saving the dog. I mean, and my partner at work, I was on the Matt Ramona show, radio show. My partner was like, she didn't mean that. Yes, she did. Yeah, she did. But understanding that it's just a disease could make it funny again. And understanding that I can't control it, and understanding that all I can do is be different. Is if I found out I had dementia today, what would I do different? Does that mean then I start taking care of myself, doing the things that I was mad at mom for not doing? Is that when I start walking? Is that when I start practicing better sleep hygiene, as you like to call it? Is that when I change my diet and manage my diabetes? Is that when I lose weight? Is that when I finally get my, financial affairs in order? Is that what I need?
It's too late at that point, but well, actually it's not.
I could do all that now.
The number one number in your life that matters is your blood pressure. And when
you say that number's even bigger than the
401k.
A1C?
Yeah.
oh, the 401k, yeah.
But well, the hemoglobin A1C is also important because it, tells you about your diabetes and the management of it. There is no question that there is a change in the philosophy about dementia and maybe even Alzheimer's, in that cardiovascular risk factors are probably a predominant marker for whether or not you're going to develop it. Now, and so we are obsessed with people's blood pressures. I also oftentimes patients will go to the primary care doctor, and they'll measure your blood pressure, and let's say it's 155 over 94. And the patient says, it's high every time I go to the doctor because I have white coat syndrome. I get nervous around physicians. Mm-hmm. Well, I personally don't think white coat exists. It means every time that you get a little tense, your blood pressure is shooting up. And there are plenty of studies to show that people who say that they or are designated as having white coat syndrome have a higher incidence of stroke, heart attacks, heart failure, the whole gambit. So I want patients to, if that blood pressure... Is it
because they're so afraid that they're not getting care?
No, I think that it's just part of who we are as, as we age. Our vessels become a little bit sclerotic, and so they don't expand, and so our blood pressures rise. And so sometimes we need a small amount of antihypertensive medication as we age. It's not uncommon, but I want people to ask when it's 155 over 92, you say, I think it's time for me to speak to the doctor about this. I want to make sure that my blood pressure is normal. Elevated cholesterol. Now, when you get up into your late 80s and early 90s, I don't really care about cholesterol too much. But mid-range in the 40s, 50s, 60s, I think it makes a big difference. And I think the statins have been almost a miracle in most cases. So cardiovascular risk factors. It's interesting that the number one marker for cognitive decline in a lifetime is hearing impairment, hearing loss. And so I like to be aggressive about that.
Okay, that's my next stop, Chuck. My next stop is hearing.
I think you hear pretty good when you want to.
Okay, there is that as well.
So, but you're right in that right now, we have this tendency to take all these supplements. Someone at the beauty parlor or at the barbershop will say, you really ought to take this green stuff and drink a bunch of it all week, and it'll really save your life. And there's no evidence for any of that. Vitamin B12, yes. Vitamin D, yes. And pretty much the other stuff, if you're on a statin, maybe CoQ10, but I just feel like I want people to take better care of themselves. It's much better to take a walk, as you say, a 2-mile walk, as opposed to taking all these supplements.
Mm-hmm. What are the other risk factors that I can work on? And as a Black woman with such a huge family history of dementia, am I doomed? Because women, more likely, look at Black people, more likely, well, I'll be darned.
Well, I think your mother had vascular dementia. I don't think, and the reason why vascular dementia is a little bit different in that speech and language are almost always spared until the very end. And she could communicate perfectly. Now, what she said...
Well, towards the end, she could only hum.
Well, but that's again, the frontal lobe at its end stage, okay? There are hummers, there are clickers, there are screamers. That's one you don't want.
Yeah.
Every 30...
Thank God for the humming. But even though it was the same tune over and over and over again, I am thankful she was a hummer and not a screamer.
Well, the vascular dementia, she had all the risk factors. She's hypertensive. Hypertension among African Americans is very sensitive to salt. Caucasians, you can fluctuate the salt; it doesn't do anything.
Salt is just so delicious.
And I think that for generations in Black families, there have been stroke after stroke after stroke because of hypertension. And so we want to be very aggressive about hypertension and diet risk. There's not other risk factors that you can control. They talk about
sleep. Sleep. Sleep.
Well, sleep is very important. I like, now you're going to get a kick out of this. I like people to get 9 hours of sleep. I like them to go to bed at 9 o'clock, and I like them to get up at 6. They get 9 hours. You're doing the math.
I'm trying to do my life around. Like,
Nothing happens after 9 o'clock that's worth anything.
Okay.
And
I am in bed by 9, but I'm not sleeping.
Like trashy TV.
No, I like really random trashy videos on social media.
Okay. All right. So, but do those at 7:30. Okay.
All right.
But also sometimes when we watch things at night because of blue light, it stimulates our brain. And so then you get into bed and you get all these thoughts. One of the ironies of life is the fact that if you get up at night and you get back in bed and all of a sudden you have all these thoughts, it's the worst things that you've ever done in your life. You regret everything.
Sometimes I lay there and I say, God, please change my thoughts.
Please change my thoughts.
Change my thoughts, Lord.
I call it the hours of despair, And, we live in a very anxious world. And you mentioned it interestingly.
I have a diagnosis.
Yeah.
I like to call it my negative imagination, but my doctors are like, it's anxiety.
Well, we're born with it. We're born with it.
I got extra.
And for you, anxiety drives you. A lot of anxiety. Some of the best surgeons I ever worked with.
Let me tell
anxious.
you, I have done some very good work for many nonprofits on crisis planning, because you get somebody with natural anxiety on your team planning for a crisis, and I can take you through every possible PR or natural disaster you could think of.
Well, but there are certain anxieties that have gotten out of control. Anxiety in the human brain is manifested by obsessions. And so when you think of it, anxiety is the root of obsessive compulsive disorder. The compulsion, of course, is what we do to make the anxiety go away. The obsession, then we do something repetitively. Women, a little nervous, they will knit all day long. That's,
I know a woman who has crocheted a string that's probably as wide as this country by now.
She's calm when she does it. The really sad thing, of course, is with the phone.
That's hard.
I think the younger people, we are no better at my age than the young people that we criticize so badly.
Yeah, it cracks me up when people say, these kids on social media. You're commenting on social media, so you're kind of doing the same thing.
Exactly.
Lead by example.
And I notice sometimes in a restaurant, someone will have these 3 beautiful children, and and the mother and the father will be sitting there on the phones, and what you want to do is say, talk to these children, please. Tell them when you are on that phone, what you're saying to them is, this phone is more important than you are. You need to talk to these children and tell them, put your phone away and let's all be a family.
So as it relates to the brain, I have been told that the best possible cognitive exercise that we can have is human conversation.
Absolutely.
It's better than any puzzle. It's better than anything that they sell you as a supplement. That
human contact
conversation.
This is Late Fragment. Is a book that it was a hard book to write, and there are parts of it that are hard to read because it presents to you some of the factors of why life is tough. I take you through the second part of it's called Jeopardy, and I take you through all of and these are older people looking for something to hold on to later in life. I'm talking 80s up into the 90s. And one of the things that I wrote about is I interviewed lots of people for the book. And one thing came through at the end. And that was that these people were calm. The people that got it, that seemed to get some of this human experience right, they were fearless. They were calm. And what they had, though, was this tremendous gratitude, not for the success they had. It was very clear. One guy said to me, he said, what I did doesn't matter. No one wants to listen to what I did in New York City, and no one wants to know how much money I made. But what they do want to know is if I'm listening to them and they're listening to me at drinking coffee in the morning, just these simple things. There's a chapter in there called So Much Depends Upon Lunch. And it's just about this couple that loves going to the Dairy Queen. And I just tell this story about them. They're the marvelous people who have had this good life, but human interaction, what you said is the gratitude for the people in your life. The gratitude, I want your mother gave you so much. And a lot of your strength comes from her. Your ability to say, the hell with this, I'm not doing that, we're going to do it this way, comes from her.
Oh, yeah.
And so all of these sort of sketchy things, a little bit of angst and maybe a little bit of guilt about things, get rid of that. Go back to her when she was your mom and y'all were soul sisters, and use that as a strength. Don't let this stuff, recent stuff, bother you. You did a marvelous job taking care of your mother.
And you know what? I am so glad that I did the work so that when people came at me on social media with things like one of the original comments was, why are you exploiting her? Like that, I was somehow celebrating, like I was, exploiting her for views. Well, actually, my job was to share my life.
Mm-hmm.
And if I couldn't share that part, I wasn't showing up.
Yeah. You were just sharing to the world.
So I tried to do it in a way that I felt would be uplifting and empowering and educational. And that kept me going. So when I did have to make those tough decisions, whether it was a family member or a friend or a boss or someone on social media criticizing me, I felt I was doing the right thing. I had prayed about it and I was managing all of it to the best of my ability. So if someone criticized me, and they did, for placing her in a home, I knew I had done the very best thing for her and me. And going forward, one of the things that I will say has been so helpful for me in moving beyond the grief, because grief has been, those early stages, they were powerful and sometimes still are. However, what I learned during dementia care about taking care of myself, about taking it a day at a time, about not trying to control everything, and most importantly, about gratitude.
There's a calmness that comes from it, and acceptance.
That is what gives me hope. And if I can share anything with anybody, I feel that the most important life-saving thing I can share with you is hope. That if I could get through it, get to the other side, go through an incredible career and personal transition with my mom at the same time. I mean, 2021, let me tell you, 2021 came in like a beast.
COVID was nothing.
Honey, COVID was like, I was at COVID mode. I'm an only child. I was raised for isolation and hoarding toilet paper. But 2021 changed my show, changed my boss, lost 2 uncles, an aunt, my mother, my stepfather, my dog, all while still working. And what kept me grounded was exactly what you were talking about. It was the gratitude for the people who showed up and for God who gave me strength.
Support.
To do it.
There's always going to be people to criticize. There's always going to be them.
And I'm all here for the people who are showing up with solutions.
Well,
and I am grateful for the solutions that Memory and Movement Charlotte are bringing to families with the Alzheimer's diagnosis, with the Parkinson's diagnosis. When is it time to come see you? I feel like I'm okay now. Things are, I'm my usual amount of dysfunction. However, when is it time to say, all right, Memory and Movement, test me. I think there's something going on here.
Super agers. In my first book, I wrote a chapter about super agers, people that function at 60 or 65 like they did when they were 20.
Oh, that's my Aunt Ada. I know. Please let me be like my Aunt Ada.
I know. You want to be a super ager. And super agers love to be tested. I had one lady that she blew the doors off the test and she said, when can I come back and be tested? I said, you're out of here. You don't need me. I don't like baseline. I don't like people subjecting themselves to this neuropsychiatric testing unless there are very specific reasons for it, because the tests are not easy and you can get overwhelmed and you come out of there losing your confidence. So if it's there, it will find you. Okay. So do not go looking for it. All right. There's no right now. We have some hope with some medications, but it's not enough to say, oh, I want to know so I can go on those medications. You do not. And one thing that I will have to say is I know I've spent probably as a physician, there may be another physician who has spent more time with patients and caregivers than I have. There may be. Peggy Knoll in Asheville may have spent as much. But I've probably spent more time the two of us, more time with patients and caregivers than any physician ever. So I know these histories, okay? I know what patients. I don't know anybody that had every single symptom and every single semi-catastrophe that you and your mom went through. I mean, the mobility issues, the delusions, the disinhibition.
Ooh, yeah.
I mean, she was good at that. Also, testing the relationship. Also, the sort of the late realizing that you were the one that was holding this whole thing together, and you thought it was her. I'm glad that your drainage,
My cyst.
your cyst went down. Thank God it was just a cyst.
You'll have to see that story in one of the previous episodes where I talked about I trusted my mom with one of her old school remedies and wound up sitting at work with a
I know.
sanitary napkin on my
I don't
chest.
even want to talk about that.
Yeah.
Okay.
I will tell you how it ended. I wound up going to urgent care, and they told me had I not busted it open on my own, they could have very easily and cleanly just taken care of it.
Well, your mom, I don't know.
Since I had done the mom remedy, I had to milk myself for 48 hours.
I'm with her. But to get one of the things about being a caregiver and surviving it all is that almost to a person, they are strengthened in some way for a couple of reasons. But one is that life doesn't have anything harder for you than to hurt like they did to your mom in that relationship. You're inured. You are tough. Don't waste my time. And
I don't have it for anybody anymore.
And the second thing that comes across when you are talking to your audience and things is that you've had a proximity to human suffering. And in your attempt is to say that we're all going to go through some sort of suffering.
Live long enough.
And let me help you. Let me tell you. I want to know about what you're going through. And the last thing is, I think you probably, with your value system, you say I'm an only child. I think you would have walked alone, even if you had had brothers and sisters. It might have helped to have a family that would help you, but walking alone has made you tough.
I tell you, Chuck, I have watched some families. I have some friends who have brothers and sisters who have walked alone.
Absolutely.
So I remember all the years I was like, why don't I have a sibling? And I watched people with siblings have more challenges as they try to have a meeting of the minds over the right way, or why don't you help more? And I saw another layer of emotional stuff that I was truly thankful I didn't have to deal with.
Well, that's what, calm, clean, safe, and loved. The loved is trying to show families how each person can use their strength to help the care of the patient. Sometimes we're successful, sometimes we're not. All families are dysfunctional. And any family that tells you they're not are really dysfunctional.
I feel like our Holloways are really, really good at it.
Yeah,
they're good. Really, really good.
Well, the Edwards, we can go one-on-one with you, I think. Okay.
Chuck, thank you so much.
I've loved our time together.
I have loved our time together as well. Please, if you haven't learned anything else today, understand that you cannot and should not try to do this alone. I am thankful for the partnership of Memory and Movement Charlotte. Please check out his podcast. Please tell us a little bit about that.
Well, our podcast is, it's called On Your Mind with Chuck Edwards. And what I say at the beginning, Brian, who's behind there, helps me, and so does Melanie. What we try to do is to aid people in understanding this aging thing. We have lots of different ways to come at it. Caregivers, patients. A theme is people who have struggled, and then use that adversity in their life to combat it. I love that resolve, the saying, this has happened to me, and I'm going to do something about it. And I think you have that. I like our chats.
I love this guy. Thanks again. And thank you for enjoying, hopefully, and learning from Hope with Ramona Holloway. We'll see you next time.
This podcast was made possible by Memory and Movement Charlotte, a nonprofit practice providing comprehensive clinical and diagnostic expertise for individuals with cognitive and movement concerns. Find the Memory and Movement Charlotte website at mmclt.org and listen to Dr. Chuck Edwards' podcast, On Your Mind, at Apple Podcasts, Spotify, and everywhere the finest podcasts are found.
Thanks for sharing hope with me. If you'd like to connect, go to RamonaHolloway.com. You can find me on my socials. Once again, Ramona Holloway. And if you'd like to support this podcast, guess what? RamonaHolloway.com.
QueenCityPodcastNetwork.com.